My name is Deborah Wang, and I am a Rosalynn Carter Mental Health Journalism Fellow from 2018 to 2019.
Rosalynn Carter started the Fellowships for Mental Health Journalism in 1996 to combat the stigma associated with mental illnesses.
When I started the project, I got to know a young man named Calvin and his family. He was living with a serious mental illness.
A couple months into my fellowship, he died by suicide. And so I told their story, and I told the story of what happened to Calvin. And that also got me thinking more about suicide prevention, and so I did some suicide prevention stories.
The goal is to reduce the incidence of suicide by improving the mental health climate at schools. When kids struggle, they may not seek help from adults.
Training on suicide, I think, is really important because, and I didn't know this because I'd never covered a suicide before, but there are a lot of best practices, and you can find these best practices on the Carter Center website and on Pointer and on a lot of other places. But there are a lot of things that you should be really cautious about when you cover suicide. You really shouldn't talk about the means by which a person died. You know, there's always this fear of contagion. There's also language. There's a move not to use the word commit suicide because commit implies commission of a crime, and suicide is not a crime.
The way mental illness is covered in the media informs public perception.
That the story of suicide is really more than the story of one person who takes his or her own life. It's a story that should be much fuller than that. And there should be more context to it so that it's not just a story about death.